7115. I'll double check it.
Well, how could that be? Wait a minute, we did it twice.
Zeroed out when he was standing on it.
No, I did.
But he did.
Let's see.
Now I'm getting. Stop moving, buddy. I know he was a good guy. 7-1. Yeah, like straddling 7-1.
70.
I know.
Yeah, 7065.
Okay, buddy.
So I think that's about what I got when we first tested them.
Yeah.
So
7-1 is the verdict?
no,
Rounded off. I
7065.
he was 744 when I went last. And now he's back on it. So it's 7065.
Oh, well, that's
So like really, if you do two significant figures, it was just 7.1. Is where it ran off. Now he's 7.75. What's up, buddy?
No, can't be right. So he lost about 3 ounces in a little over a month.
It's not bad.
Really?
Not horrible. No. And it could get changes, kind of fluctuates day to day. Yeah, there's little ounces.
He's had a couple of non-bowel movement days, but that seems to happen all the time.
Yeah.
He has a good one, and then he'll go a couple of days without, and then he'll have another one if you feel any.
I don't feel any sinking masses, just feel a layer of thickened loop of bowel in here, in his kidneys. Yeah, that's what I'm feeling. But I don't feel any tumors or anything like that. His bowel feels almost like either inflammatory bowel, kind of lymphoma-y bowel, but thickened, doughy kind of palpation of it. A little bit of fluid in here, like fluidy, like in his intestine, not in the abdomen. Not like he has ascites or fluid filling up his abdomen. So he's had diarrhea or no?
No.
It's been normal? Good.
No.
So there's a hard stool here I'm feeling, so he's got a poop in there too. You're okay. It's okay. I'm just going to listen to you, bud, okay?
They shut
Good
the air
job,
off so you can
James.
hear him better.
Yeah, heart murmur's about the same. I get 2. It's okay, dude. It's okay.
He likes to scale.
Any breathing problems or coughing or anything like that, or are you still okay?
No, I mean, how would you describe what he does with the?
It almost sounds like he's trying to cough up a hairball,
Yeah,
but there's never a hairball and nothing ever
just
comes
kind of
up.
like a dry heaving or
Yeah.
retching that he's
When
doing.
they put their head close to the ground and the head sort of goes side to side.
Lungs sound clear. Deep breath, okay? So I don't hear any congestion in his lungs or fluid in there. Like a 2 to 3 out of 6 heart murmur. It's loudest here over the mitral valve of his heart. But I hear it in there. So yeah, he's got a heart murmur, which we know about already.
Right.
You're okay, little guy. But nothing, it's not like dramatically different than it has been. It's okay, I know you hate when I look in your mouth. You're not a fan of that. You're okay, buddy. Let me just see your eyes. I want to see your pupils. They look good, right? His pupils are responding to light appropriately. So cats with high blood pressure usually are going to have big pupils, right? They just don't, it affects the optic nerve, so that doesn't respond to light appropriately and their eyes stay big. The fact his pupils are nice and small tells me he's doing okay, and I like that. It's okay, I just want to see your gums. Now I know.
Come on,
they're
Jiggs,
they're
open
pink
up.
in there. They're pink. I saw those. It just fell out a little crusty. That fell out of your mouth. You're eating a fly? He was eating a fly. What is that? Yeah, you're eating a fly. I'll put that on the floor for later, okay?
Oh, nice.
You're like a fly. His gums are nice and pink. Look at that. Beautiful.
Okay, well that's good.
Yeah. He feels dehydrated today. He's got some skin tinting here. But I think this cat is still defying every expectation I've ever had for him.
Well, we're up to 14 months now.
Incredible, right? He's like the
So
bionic
now
cat.
I know you mentioned when we were talking about a little dehydration and
Yeah.
do we want to hydrate, but then that can also affect the heart a
can.
little bit.
So
So
fluid's going to be contraindicated with his heart, right? So my good intentions of hydrating him, all that extra fluid is just going to overload his heart and potentially can push him into heart failure.
So what do? Does if he
we would
looks,
have to moderate our fluids. We would be like, instead of 100 milligrams, you would probably do 50, right? So you take it to that level maybe once or twice a week just to keep him hydrated. Anything more than that, it's probably going to affect his cardiac output, so I wouldn't go too crazy.
So does he? Well, again, does he appear to you that he needs fluids?
I mean, I'm just gauging that he feels dehydrated, so yeah. He does. He should have some more hydration. It could be his kidney function. There could be another reason for his dehydration. Do you see him drinking?
Oh yeah.
Does he drink a lot excessively or
Well,
just moderately?
A good amount because
Yeah.
he does, the steroids.
Yeah. So it could be that we're making him drink and drink and drink, but it's kind of counterintuitive. The more you drink, the more hydrated you are. So is it having to do with his kidney function, that he can't concentrate his urine? And that's why he's drinking more and dehydrated. It's kind of a paradox, right? So red flag. So running blood work would tell me what his renal, I'm not going to stress him out. I draw blood and urine on him and we can do all that to him. I can. But, you've come so far with this guy. And for me to, yeah, he could benefit from some fluids, 100%. And keep it simple. Do 50, don't do 100. It might help. It will definitely, address his hydration status. If he has any electrolyte imbalances, it will address that. But the only real way I'll know is to run blood work on him. What is his hematocrit? What is his urine concentration, his specific gravity? Does he have, that's really where I can gauge for dehydration. Those are the things I need to look at. And if he's in kidney failure, his urine is dilute and he's dehydrated, then it's masking the real numbers in that blood work, all right? But I think this cat is more than a success story. He's thriving and doing okay. I wouldn't get too caught up in ounces here or there. I think for the most part, he's maintaining. He's down a little bit. I would have expected this cat to decline a lot faster than every expectation that every doctor you've been to, even at the specialty hospital, and whatever they told you, that we've come this far with a provisional diagnosis of lymphoma or inflammatory bowel and heart disease if it's primary or secondary to anemia, and we've come this far. Incredible. All right, we're dealing with some pretty severe anemias. Hematocrit dropped quite low, but now it looks like that Barrison 1 is probably just really keeping that in check.
We've been on that for
Yeah.
14 months.
But it would be reasonable to do a senior wellness on him. Like in an ideal world, you would check his thyroid, his CBC chem, and urinalysis. That's the only way you're going to know about his kidney function, his thyroid level, all that stuff. Cell blood count. But without that, all I can tell you is what I see on a physical exam.